Hello, my name is John Thurlow. I'm a physiotherapist working for Somerset NHS Foundation Trust. And I'm going to talk about patellofemoral pain, sometimes known as anterior knee pain. I'd like to explain something about the condition itself, the symptoms you may experience, and give you some ideas on how to manage these. If you want to skip to any of these subjects, there are links in the comments below that will take you to the part of the video that you are looking for. This is a picture of a knee joint. This is the thigh bone and this is the shin bone. The bottom of the thigh bone has a groove in the front where the patella or kneecap runs up and down when you bend and straighten your leg. The back of the patella is cone-shaped so that it fits into this notch, creating what we call the patellofemoral joint. The joint is a common source of pain, and a quarter of people may experience patellofemoral pain at some point in their lives. The patella lies within a tendon of the quadriceps muscle of your thigh. This is the muscle which works to straighten the knee. Sometimes people experience pain in this area when the muscles are not working to pull the patella smoothly through the groove that it fits in. There may be an increased area of loading in this part of the joint, rather than evenly spread load, and this can cause pain. It's worth noting that this isn't a condition where things are wearing out or deteriorating. In fact, there's no damage being done to the joint surface or the tissues. It just hurts. That's why we don't see anything particularly useful on an X-ray or an MRI scan for this condition, so it's not typically offered. There is a similar but distinct condition of the knee called chondromalacia patelli, where the pain also comes from the patellofemoral joint. This condition involves a softening of the articular cartilage behind the kneecap, causing pain and eventually changes in the cartilage underneath the patella. This is different from patellofemoral pain, in which no structural changes occur, just uneven loading. There are a few different factors that can cause this uneven loading. Women are affected more than men, as the wider pelvis means the thigh bones have a steeper angle into the knee, and this might predispose to pain. Weakness around the hips and gluteal muscles can cause the thigh bone to roll inwards under the kneecap. Tightness of the quadriceps, calves and hamstring muscles can also be an issue. Weakness in the core muscles may also contribute. Even your foot posture can make your knee more prone to coming inwards, which can irritate the patellofemoral joint, particularly when it's sore. With a number of different factors involved, there are a range of things that we can do to advise you to support in improving your pain and returning you to the activities that are important to you. People with patellofemoral pain sometimes tell us that they don't like taking their weight through a bent knee, so activities such as squatting, lunging, running, or using stairs might cause pain. Anything that compresses the kneecap onto the joint may also irritate the pain as well, such as sitting with a bent knee for a while. We call this moviegoer's knee. Sometimes kneeling down and even wearing tight trousers can also cause an increase in symptoms. We often hear people talking about clicking and grinding from behind the kneecap. The good news is that this doesn't indicate that anything damaging is happening there. But we do know that this can be frustrating for a lot of people. Knees seem to be noisy joints, and you're likely to find that these noises don't go away, even when the pain improves. Physiotherapy can help by strengthening the muscles in the leg and improving the flexibility, to even out the load going through the joint. Initially, when starting to exercise, the knee can be quite painful, and we tend to find that people don't do as well with their rehab when their pain is poorly controlled. This isn't one of those conditions where you just need to push through pain, so getting your pain levels down is a good first approach. You can do this by pacing your activity, or by using oral pain relief where appropriate. Sometimes icing and using taping techniques might help as well. Using insoles to support the arches may improve your symptoms if you have a poor foot posture. You can buy these yourself from a pharmacist or over the internet, or you can talk to your GP or physiotherapist about whether a podiatry referral is appropriate for you. Stretching any tight muscles and strengthening the gluteal and hip muscles is also a useful place to start with the rehabilitation, as this is likely to be manageable without flaring up the pain. Also, working on your core muscles may be helpful. Your physiotherapist can help you identify and improve on any problems here. When your symptoms become less irritable, we can also support you in finding ways to strengthen the muscle around the knee itself and to work on pain-free movement patterns.
Quad stretching. Hold onto something for support if you need to. Bend your knee and grab your foot. Hold the stretch for 30 seconds. Calf stretching. Face a wall and push your heel behind you until you feel a stretch over the calf. Make sure your foot is facing forward. Hold for 30 seconds. Hamstring stretching. Place your foot out in front of you and bend forwards over your straight leg until you feel a stretch at the back of the knee. Hold for 30 seconds. Bridging. Lie on your back, breathe out and squeeze your bottom to lift your pelvis up. Breathe in and gently lower. You can make this exercise harder by holding for longer or by using one leg at a time if you can keep your pelvis level. Straight leg raise. Lying down, press the back of your knee down to tighten the muscles above your knee. Then lift the leg straight, about 10 inches from the surface. To make it harder, you can hold the leg for longer.
Should your symptoms persist and show signs of no improvement after 12 weeks, then you should inform your GP or physiotherapist. Thank you.